Hello, my name is Xin. This video is used for my subcutaneous checkup. Before I enter the patient room, I am gonna check the patient's the healthcare provider, and the patient's name is Anna Kowalski, and the med I'm gonna give or administer is vitamin B12 through subcut, and the dose is 500 mcg, and um, the patient is Anna Pulaski, and she's allergic to penicillin. And I knock the door, and I wash my hand. I introduce myself. Hello, my name is Sina, your student nurse today. I'm gonna give you vitamin B12 for your vitamin B12 deficiency through subcute today. Before I start, can I have your name and a date of birth, please? And the patient. I'm gonna check the patient's armband as well, see if everything matches. And then after that, I'm gonna ask the patient about allergies. And I also gonna check the armband for the patient's allergies and ask the patient like what the penicillin gonna do to the patient. And the patient probably gonna say like she's gonna develop the rash. And after that, I'm gonna check my 6 red, and I have the red patient, which is Anna Kowalski, and the med is a vitamin B12. This is a vitamin B12, and as the expiration date is up to date. And after that, I am gonna also check the dose is 500 mcg, and the route is a subcut. I'm gonna give the patient subcut, and the time and date of time is correct as well. It's today's date, and it's right now time 14:58. And after that, I'm gonna give the patients some education about the mag and how the medicine here. So vitamin B12 is used for the vitamin B12 deficiency. I am gonna encourage the patient to comply with other DAP's recommendations of healthcare profession, say, and I am gonna ensure the vial is deposit, keep the vial away from the light as well. And I am gonna look for the lab value for vitamin B12, and also I'm gonna check the signs and symptoms of the vitamin B12 deficiency, like a pallor, neuropathy, psychosis, red or inflamed tongue. And I am gonna tell the patient there are some common side effects such as hypertension, rash, asthma, red urine, anaphylaxis. If you develop any of the symptoms, please let us know immediately. And after that, I'm gonna check the patient's safety. So the bed is at the lowest position. There is no cluster on the ground. The brake is on. The collector is within range. There is nothing on the ground, like no cluster on the ground. And I am gonna use the posterior aspect of the arm as my injection site, and I am gonna calculate my dose. This is the 50 mcg, and it is 1 ml at 1 mg, 1 milligram per 1 ml. So it's 0.5 ml med I should be give to the patient. Okay. After that, I'm gonna have all my supplies here. So I have my 25 gauge, and then for the needle, and this is the 1 milliliter needle, syringe, and the alcohol pad, the gauze, and then my mat, and the sharp container, my electronic health record, and also my gloves, my clean gloves, and After that, before I draw the medication, I'm gonna wash my hand and verify the rate of the medication. The patient's Anapawasky, the med is vitamin B12. The med is 500 mcg, and it is 0.5 ml, and the time is correct time. The route is subcute. And I'm gonna wash my hand again, and I check the patient is allergic to penicillin, and also check the armband, and I am gonna clean my gloves before I withdraw the medications for 30 seconds, and make sure clean it really well. And I'm gonna write the time now, and I am gonna put my initial on the label, and also the time and date. And after that, I am gonna draw, like I'm gonna open my needle by using the rainbow technique, and I am gonna draw 0.5, which is milliliter, which is equals the dose I'm gonna administer to the patient. Okay. And I'm gonna insert the air to air into the valve to make sure it has an equal pressure, and I'm gonna withdraw the mat. I draw a little bit more than 0.5, and there are some air bubbles, so I flick it and pull the extra mat out, and to ensure there is no air bubbles. Okay. So it's 0.5 now. And after that, I'm gonna use one hand technique and to recap it. And I'm gonna label my syringe with the patient name, the drug name, with the vitamin B12, and the 0.5 ml, as well as 500 mcg, and the time and date. And I put my initial on here. And before I administration my mat, I'm gonna make sure the patient has in the good position to give the patient's mat. So I am gonna ask the patient to relax and put the arm on the firm surface, and then sit down. And I am gonna check the 6 right again. So I am gonna, this is the blood patient, Anapawasky, and the mat is the vitamin B12, the orange says vitamin B12, it's a 0.5 ml as well as 500 mcg, and this is correct as well, and the date and time is correct, and the route is subcutaneous, and this is the subcute. And after that, I am gonna document. and I am gonna clean the skin before. Oh, sorry. I am gonna wash my hand before I do anything else. And then I'm gonna apply the clean gloves. Before I touch to the patient. I'm gonna use the alcohol wipe to clean the injection site for 30 seconds in circular motion from center to outward. And I'll allow it to dry, and after that I am gonna give my mat. I open my syringe, open my catheter removal technique, and then I pinch the skin, and I insert it through the 45 degree to 90 degrees. So I'll just use 45. And I'll just to give the mat slowly. And after that, I am gonna remove my hand. I'm gonna like to remove my needle and then release my hand and engage the safety on the needles and dispose it into the sharp container. And I am gonna use the gauze to apply the gentle pressure on the injection site. And I'm not gonna massage it. And after that I'm gonna clean like everything and then remove my gloves. And, I am gonna document it. The vitamin B12 is given to the patient at correct time. And after that, I will check the patient's safety. So the bed is lowers the position, and the collar within reach. The brake is on. There is no cluster on the ground. The setters are up, and I'm gonna also open the curtain or the door. Oh, not really the door, but I mean I'm gonna ask the patient if the patient will leave the door open or closed. If it is the door, and after that, I am gonna ask the patient, is everything okay? Are you feeling okay? Is there anything I can do to you before I leave? And I am gonna wash my hands. And that's it.